Anytime we talk about a drug, a medicine, in this case, we're talking about magic mushrooms, the first question that comes to mind for the vast majority of people who don't take them is what do they do? How does it work on the human mind, the human body? So statistics show that around 8% of Americans have reported using psilocybin at some point in their life. What does happen if you take one of these? Well, first, the serotonin receptors in the prefrontal cortex, they're activated. And that's the part of the brain that affects mood, cognition, and perception. About 30 minutes later, usually accompanied with some nausea, the drug is fully digested and you begin to quote unquote trip. Your eyes might dilate, hallucinations can occur and last for up to 6 hours. Users have reported seeing halos of light, vivid colors, kaleidoscope patterns that morph in terms of faces and all of these other things in a dreamlike state. People report feeling euphoria, spiritual awakenings, uncontrollable laughter, a sense of connectedness. All of these things are reported with a good trip, but what we need to talk about also is these bad trips, which can include paranoia, frightening hallucinations, vomiting, anxiety, and in some cases, even a trip to the ER. And I will say this, for those who want to get a taste of what it might be like to experience it, we actually have, for some of our audience members, these hallucinogen glasses. So why don't we all, just for the sake of experiment, put them on?
Hello, 60s.
Drew?
Yes, sir.
Oh,
Is this what it was like for you?
No comment.
I mean,
I can tell you this, you certainly would not want to operate heavy machinery. You wouldn't want to be driving a car. You would not want to be taking care of a small child. It's definitely a trip.
well, look, a small proportion of people who try hallucinogens, including magic mushrooms, they do develop a condition called hallucinogen persisting disorder, which means that they kind of just keep having these trips and they're kind of uncontrollable and they keep going even when you don't have the substance anymore in your body.
Have you seen them in your practice?
Yes,
And,
yes.
and Travis, in the ER, have you seen people that have come in?
Not for magic mushrooms. And then again, a lot of times people come in and you're not sure what they've taken. So
Right.
I do think that one of the things that the marijuana debate has done in our society is it has forced people to at least acknowledge, okay, are there other things out there that might have some benefit? And I think it's important to be willing to have these conversations and not just carte blanche say, you know what, it's illegal now, it should never be legal. We need to at least address these things.
I think we all agree.
And I think we also could all acknowledge that heroin, incredibly illegal, and yet there are many legal preparations of opiates that we use in medicine every day.